Hello, and how are you? My name is Winnie Barawa. Welcome to our session on preparation for de-infibulation procedure. If you're new here, this is a channel that focuses on lectures, lessons, and interviews pertaining to healthcare. In this series, we are covering a series that tackles ending female genital mutilation in our community, and this is a supported series in partnership with the University of Nairobi, the Girl Generation, and ACAF, which means Africa's Coordinating Center for Ending FGM or for abandonment of FGM. So be with me till the end, and if you've not watched our other videos on female genital mutilation or CAT, you can review our series on gender and sexuality, or you can review through our playlist that specifically targets ending FGM in partnership with ACAF. So in the previous video, we tackled the different timing that we can do the infibulation, and we mentioned that we can do it during the pregnancy, that is antepartum, or we can do it during labor and delivery, which we call intrapartum. So you can check more about it. But now in this video, I would like us to focus more and look at what preparation should we do when we are looking at a woman who needs to go through de-infibulation. So the first part of preparing for de-infibulation is to counsel the mother or to counsel the lady. And counseling the lady is very good, but also if we can work with the partner, is this a husband or the romantic partner, or is there a family member who is the companion to the woman during this process, then that is really good. So the objective of the counseling is for the woman to reach an informed decision about the procedure and what their thoughts could be surrounding it. This is actually going to build the confidence of this lady. It's also going to increase her level of cooperation and reduce levels of anxiety that she could be having around the procedure itself. So this should ideally be done early enough to allow adequate time for informed consent and decision making, whether and when to undergo the procedure of de-infibulation. Remember, we are advising a lady who is pregnant, although sometimes some ladies may come when they're not pregnant and they wish to go through the de-infibulation. Mark you, this is from the level of awareness that is ongoing about female genital mutilation and the interventions. So in cases where we're dealing with a pregnant woman, then it is really good that we engage and get them have informed decision so they can decide at what time do they feel the procedure should be done. So ensure privacy and confidentiality during this counseling session. We would like the lady to be well assured that each and every information that they give in the process will be treated with high level of confidentiality. There will be no exposure to unauthorized members of society or staff. And so that is really, really important for this client to understand. So in the purpose of the information that we shall share to the lady who is being counseled, the first part is we need to help the lady to understand the health risks that are associated with type 3 FGM. What are the possible complications, both long-term and short-term complications? The immediate ones that come around immediately a woman has gone through an FGM experience, and the long-term risk that the lady actually is likely would be able to get if there's no intervention done to them at that particular time. It is advisable that the woman gets to undergo the procedure, and therefore, as we advise, it's really good that the lady understands why the de-infibulation procedure will be important to them, share information regarding the anatomical and physiological changes that will be expected after de-infibulation. And in here, we shall discuss more about the infibulation procedure itself in our next class, and you shall see the post de-infibulation management that the lady should go, including which will go through, including the anatomy and physiological changes that can happen. For example, changes in their urination, some can have change in their menstrual cycle, but that's key area that we shall do in the next video. Then it's good that the lady understands the dangers of re-infibulating. Note that it is prohibited that any woman who has undergone through FGM to go through de-infibulation, then re-infibulate. So re-infibulation is actually a criminal offense and it can be charged in a court of law. So it is not allowed that once a woman has been opened up that she should be sutured again. That's not allowed. So explain to her the dangers of re-infibulation, explain the procedure of de-infibulation and also the post-operative care that will be required after it has happened. So it will be really good that we get to sit with the lady, explain to her how the whole procedure will be like, and then what care she will go through after she has completed the de-infibulation procedure itself. Then the following part is now signing the consent form. This should be done after the lady has properly understood the benefits, the risks, and even the management that shall be involved in the de-infibulation procedure. So ensure that the lady has clearly understood all this information that you've shared during the counseling stage, and then they be able to sign an informed consent form before the procedure. So pregnant women who decline the infibulation should actually be informed and emphasized on the risk that could be associated with the type 3 FGM coming at the stage of labor and delivery. And you should also emphasize on them that be that they have refused to be de-infibulated, then it's more advisable that this lady delivers in a hospital. Why is that important that emphasis is done that they deliver in a hospital? In case they refuse to be de-infibulated, then we can do alternate interventions that are safer for this mother, for example, cesarean section or assisted deliveries that can keep the baby safe and the mother safe. And in case of any complication that may occur, then the lady will be in safe hand with trained, skilled caregivers who can offer proper interventions. And at the end of a counseling session, clearly and accurately complete the required documentation. So it's good to have the informed consent form with you, and after the process of counseling the lady and counseling her through the process of the infibulation, then she can sign and confirm to you as the healthcare worker that she'll be ready for the procedure. You can book the date when she wish for it to be done. Then you can do the pre-defibulation preparation together. If there'll be any need for interventions before that, you can still do it, and then she can come for that procedure on the particular date. And to sum this up is now preparing for the tools or setting the needed tools and instruments. So the instruments, we are going to be very comprehensive, but depending on the technician or the healthcare worker who will be taking care of the de-infibulation process at that time, the equipment are very key that you do a complete set. So one of the instrument needed is the 10-inch sponge holding forceps, which is here for us. So this is going to help us in case we need to hold certain tools during the process. Then we have two long curved artery forceps. Here we have a sample. Then we have these two small curved artery forceps. Here we have it. And then we got a needle holder. This we shall need it during stitching or suturing. And then we have a one stitch scissor. So we got one here, and then we have curved operating blunt pointed scissor. So we got one here. So we have skipped on the surgical blade and blade holders. So here are our surgical blades and their blade holders or the different blade holders. We have the dissecting forceps, and we are advised to have both tooth and non-tooth. So we got them here. This is the non-tooth, and this is the tooth forceps. A kidney dish, we got one. This is for just transferring equipment from one part to another or holding different components during the process. The galley pot with sterile swabs. So these are part of the instruments that we shall need during the procedure, but additionally to this, we also have others. So extra items needed that very important also is the sterile gloves. Sample is provided here, and then we have a dilator. Now, a dilator are of different types: cervical dilators, vaginal dilators. So depending on the one needed, mostly we shall need this. And although we have this here too, so I've put this here intentionally. These are more of like silicone in a way, but the one we're going to use at this, which can be sterilized. So the dilators are very important when you want to check on the tightness of the opening. And we need a 5 syringe and needles, or syringes and needles for injections and withdrawal of medications, local anesthesia, drugs, absorbable sutures. Here is one, lubricant, sterile towels or cloth, Macintosh, antiseptic solutions, receptacle for our used instruments, and then soap and water for hand washing before the procedure. So these are tools of instruments, or tool sets and instruments that we'll need to have before we begin the procedure. I understand some health facilities are limited in resources, so in one case or another, we might miss certain tools. It's still okay. For example, we are told from different research that I was doing, in case you don't have a dilator, and because we're saying the dilator is going to help us check the tightness of the vaginal opening, or the opening that was left after the type 3 FGM had been done, we can use the index and the middle finger to check on the tightness if the dilator is not there. So some items here can be really important to have them, but if you are in a resource scarce setup, then you can set just what is needful for you to actually complete the procedure with all the necessary steps observed. So thank you so much for all who stayed all the way to the end, and I always encourage you, remember to like our video, give a comment on what your thoughts are, share these videos with your platform and your areas of interactions, and don't forget to subscribe, while also hit the bell or notification button so that when we post the next lessons, you get to be notified immediately. So thank you so much, and see you in our next lessons. Bye bye.